What if one day you noticed small holes appearing in your skin, only to find them crawling with tiny wriggling maggots? Sounds horrifying, doesn't it? This is not just a nightmare, it's a real medical condition called cutaneous myiasis. And for those with trypophobia, just hearing about it might make your skin crawl. In today's episode, I dive deep into the terrifying world of maggot-infested skin, its causes, diagnosis, and treatment. Buckle up. Cutaneous myiasis is a condition where fly larvae, also known as maggots, invade human skin, burrowing into the tissue and feeding off living or dead cells. It is most commonly found in tropical and subtropical regions, particularly in people with open wounds, insect bites, or poor hygiene. Unlike oral myiasis, which affects the mouth, this condition can occur anywhere on the body, often leading to painful pus-filled lesions. Before I go any further, a trigger warning for those with trypophobia, the fear of clusters of holes. Many people with this condition experience extreme discomfort when looking at images of maggot-infested wounds. But why does this fear exist? Some scientists believe trypophobia is an evolutionary response, warning us of potential dangers like infections, diseases, or venomous animals. If you're still with me, let's explore how these two conditions intersect. So, how do maggots end up under your skin? The most common cause is fly infestation, particularly by species like botflies, Dermatopobia hominis, lay eggs on mosquitoes or ticks that transfer them to human skin. Screwworm flies, Cochleomia hominivirax, infest open wounds and consume living flesh. Tumbu flies, Cortylobia anthropophaga. Common in Africa, they lay eggs on clothing, which hatch when in contact with human skin. Once inside, the larvae begin feeding and growing, causing swelling, pain, and the formation of boils with tiny breathing holes where maggots poke out. Symptoms of cutaneous myiasis can be horrifying. The most common signs include painful, red, swollen boils that contain moving larvae, a sensation of something crawling under the skin, oozing pus or blood from the lesion, foul odor due to tissue decay, visible maggots emerging from skin lesions. Doctors diagnose cutaneous myiasis through clinical examination, using ultrasound or dermatoscopy to confirm the presence of larvae under the skin. In severe cases, an MRI may be used to check for deep tissue damage. Once diagnosed, the maggots must be removed immediately to prevent further damage. The treatment involves mechanical extraction, using forceps to carefully pull out the larvae, occlusion therapy, covering the lesion with Vaseline or nail polish to suffocate maggots, forcing them to crawl out. Surgical removal. In deep infestations, minor surgery may be required. Antibiotics and pain management, to prevent bacterial infections and reduce discomfort. Never try to squeeze the maggots out, as this can cause them to rupture and lead to severe infection. Prevention is always better than cure. To protect yourself from cutaneous myiasis, keep wounds clean and covered to avoid fly infestations. Wear protective clothing in tropical regions. Use insect repellents to keep flies away. Avoid drying clothes outside in fly-infested areas. Iron them first to kill any eggs. Seek medical help immediately if you notice unusual skin lesions. Cutaneous myiasis is one of the most shocking and terrifying conditions you can experience. Whether it triggers your trypophobia or just makes your skin crawl, knowing how to prevent and treat it could save lives. If this episode left you stunned, make sure to like, share, and subscribe for more spine-chilling medical facts. Until next time, stay safe and stay informed.